Hi, my name is Jamie Perkunis. I'm a physical therapist, and yoga teacher. There are two practices that I've developed to help you with pre-op rehab for your knee using yoga techniques. In these videos, you'll be asked to move on or off the ground. However, if you find that challenging, consider moving to a bed with a harder mattress. In addition to a chair, you'll want to have a wall close to you. You'll also need a strap and a block. In these practices, it's important to check in with how your body's feeling and make sure that you're breathing throughout the practices. Enjoy the practices. So our first pose will be standing Tadasana or mountain pose. I recommend doing this pose with your back against the wall for balance. So you're going to stand close to a wall and take your yoga block and you're going to place it medium width between your thighs. And you might notice when you do that, it might be too wide. So maybe turn the block so it's narrow width between the thighs above the knee. Then look down at your feet and point your toes straight ahead. Make sure the pinky edges of your feet are parallel with the walls to either side of you. Squeeze the block and try to rotate the block back behind you by rotating your thighs inward. And breathe. And bring your arms to your sides, palms facing forward. As you inhale, lift your chest up. And as you exhale, root your heels down into the ground. As this pose gets easier, you can work by moving a little bit more away from the wall, or even consider closing your eyes if that feels steady for you. Try to slow your breath down and sustain this pose for 6 to 10 deep, calm breaths. And then slowly release by removing the block from between your thighs and setting it down. After doing standing Tadasana by the wall, go ahead and take your block and move it off the mat and grab your chair and bring it onto the mat. So with the chair in front of you, the next pose we're going to do is a modified pyramid pose. So you're going to point your feet straight ahead and have your feet hip distance apart. And go ahead and grab onto the chair and step your non-operative leg back behind you. And make sure that you have the chair for steadiness. And lift up through your chest and start to breathe. In this pose, you're going to try to keep your front leg, your pre-op leg, straight. You're going to start to hinge forward at your hips, leading with your chest towards the chair, keeping the front leg straight. And stop when you begin to feel a stretch in the back of your front leg. Continue to breathe. Draw your front hip back behind you. And don't worry about how far you go in this pose. Just notice the sensation in your body. Make sure it feels safe. Try to relax your shoulders. Keep reaching up to the top of your head and your chest. And then slowly come on out and step your back foot forward. And have both feet equal to each other. So step your back foot forward, feet hip distance apart, feet pointing straight ahead. And before going to the other side, just notice the difference between your right and left leg. Now take your hands back to the chair. Step your pre-op leg back behind you. Keep both feet pointing straight ahead. And find a distance that's comfortable. Try to keep both knees straight if you can. And reach up to the top of your head and your chest. Reconnect to your breath. And then start to hinge forward at your hips, leading with your chest. Draw your front hip back behind you. And find a position that you get a sensation through the back of your front leg. This side might be completely different than the other side. Breathe. And then step your back foot forward so your feet are parallel to each other. And reconnect to your breath. Notice the difference between your right and left side. So the next pose we're going to do is a modified lunge pose. So we're preparing for if we were going to do a warrior pose. Don't get scared. So step your non-operative leg back behind you. So your pre-op leg is forward. Bring your fingertips to the chair and reach up to the top of your head. Bring your shoulders over your hips and breathe. And then start to bend your front knee to a degree that feels safe, feels relatively comfortable, and a pose that you can breathe in. If you find that your knee is going over your ankle, consider stepping your back leg back a little further. So in this pose, the front knee is bending and the back leg is staying straight. Keep reaching up to the top of your head and keep drawing your front hip back. And draw your belly button in towards your spine as you reach your chest up towards the ceiling. Again, don't worry about how deep you can go in this pose. If you want to test your balance, you can take your hands away from the chair. If you want to test your balance a little bit more, you can raise your arms up overhead or even straight up to the ceiling. And then slowly bring your hands back down to the chair. And step your back foot forward, having both your feet pointing straight ahead. Take your time. You need to shake out your knee, no big deal. And now, step your pre-op leg back behind you. Start to bend your front knee. Keep your back leg straight. If you notice that your front knee is going beyond your ankle, consider stepping your back foot back a little bit further behind you. Keep your shoulders over your hips and reach up to the top of your head. Breathe here. For balance, if you want to test your balance, you can take your hands away from the chair at any point, maybe one or both. Keep drawing your front hip back behind you. So the front knee is bending, the back leg is straight. If you want more of a challenge for your balance and it feels safe, you can go ahead and start to lift your arms up parallel to the ground. And then maybe eventually overhead, reaching your fingertips up towards the ceiling. This is a balanced pose. Make sure you can breathe. And then slowly lower your hands back down to the chair. Step your back foot forward so your feet are parallel. If you need to shake out your knee or shake out your whole body, take your time. Check in and make sure your feet point straight ahead. Pinky edges of the feet are parallel with the long edges of your yoga mat. Reconnect with your breath and notice the sensations in your legs. And next we'll be moving towards the floor. So when you're ready, go ahead and rest onto your back. So you move your chair out of the way. then take your time to make your way onto your back. You'll rest on your back with your feet facing the wall, head pointing away from the wall. And then bring one foot to the wall and cross your ankle just above your knee and flex your foot. So flex the foot of the ankle that's above the knee and open your knee out to the side and breathe. We're going for a stretch either on the outside of the open knee, on the outside of the hip into the glute area, or on the inside of the thigh of the knee that you're opening out to the side. Try to keep your pelvis aligned, so try to keep your pelvis steady as your femur opens. If you want more of a stretch, you can scoot closer to the wall. And then go ahead and release and switch to the other side. So notice the difference between the sides. And then bring your other foot to the wall, cross your ankle over your knee, flex your foot. And open your knee towards the wall while keeping your pelvis steady on the ground. Keep breathing calmly and deeply and listen to your body. The stretch is to be felt in the hip, not the knee. So if you feel in your knee, just back away. It's okay to not even feel a strong stretch or even a very subtle stretch in this pose. And then slowly release. Bring your feet back to the ground and just notice the sensation in your hips. Reconnect to your breath. From lying on your back, go ahead and transition to lying on your abdomen. We're going to be using the chair for this next exercise. So roll over onto your belly and move the chair in. Bring your foot to the front of the seat of the chair and let your ankle, the front of your ankle, rest in the front of the seat of the chair. Draw your legs towards each other so that your knee, your bent knee, points straight back behind you. And then press the front of your thighs and even the front of your pelvis down into the ground. If you're feeling discomfort in your knee, consider scooting away from the chair so there's not as much bend in your knee. We're going for a quad stretch here in the front of the thigh. If you find this to be easy, you can always scoot closer to the chair, which will bend your knee more. If you want a little bit more of a challenge and your back feels okay in this position, you could always come up onto your forearms, which will oftentimes increase the stretch. If that's too much of a stretch and it's uncomfortable, then go ahead and come back down onto the ground. Breathe here. And slowly release, and we'll try this on the other side, which might be different. So we'll go to the other side. So you're going to bring your foot to the front of the seat of the chair. Once you bring the foot in position, try to point your thigh straight back in parallel to the center line of your body. This side might be completely different, so you might notice you might have to scoot away from the chair or towards the chair to change the stretch. Breathe here. There should be a stretch in the front of your thigh, but if you're getting pain in your knee, scoot away from the chair so there's less of a bend. Come into a seated position. Take your time. Be careful with the chair. You're going to come into a seated position and bend your knees and bring your hands behind you. And find a position that your hands are comfortable in. Either fingertips pointing out to the sides or maybe even fingertips pointing back behind you. You can even widen your hands a little bit more if you need. And you're going to bring your knees to touch the inside of your knees. And if this is tender, go ahead and take a towel and place that between your knees for padding. So your knees are going to stay touching. You're going to hold this towel between your knees as you walk your feet out to the side to be a little bit wider than your knees. This is internal rotation of your hips. And now reach up to the top of your head and lift your chest up towards the ceiling and breathe. And if you're feeling discomfort in your knees, then back away a little bit. If it's too intense and you'd rather not do this, you can walk in, feet in a little bit more, or even feet in and then back out again. So just keep moving if that feels better. Try to keep your chest lifting. Keep breathing. One more time. A few more breaths. You can be one more time walking your feet out. And then walking them back in. And then go ahead and remove your towel. And grab your block. You're going to place the block either medium or narrow width between your thighs, above your knees. You're going to bring your hands at either side of your hips this time. You're going to separate your feet so they're hip distance apart. Flex your feet by pulling your toes up towards your nose. And then reach up to the top of your head and lift your chest up. Squeeze the block. And breathe. Again, if you're finding this pose challenging, maybe you need to build up to it. You can release for a moment, and then you can come back into it. You can even alternate between pointing one foot or the other. Keep breathing. Relax your jaw. And then slowly release. Remove the block. And now this last pose we're going to do is turning around back to the wall and placing your feet straight up the wall. So you're going to turn around, bring your feet so they point straight up the wall. And your hips are going to come as close as your hamstrings or the back of your legs allow. So you can move really close if you have open hamstrings, or you might stay a little bit further away. Your feet could be hip distance, they could be touching. Stay in this legs up the wall position for up to 3 to 5 minutes or longer if it feels comfortable for you. This position allows any swelling in the knee to be moved into the hip. And it also allows your body to absorb what you just did. While in this legs up the wall position, we're going to do a body awareness practice. Bring your attention to the bottoms of your feet. And focus your attention on the bottom of your right foot. And then bring your attention to your right big toe, your right second toe, your right third toe, your right fourth toe, your right pinky toe. Then drop your attention to your ankle, and then down to your knee, and then to your right hip, and then bring your attention to your left hip, and come up to your left knee. Bring your attention to your left ankle, your left pinky toe, your left fourth toe, your left third toe, your left second toe,
your left big toe, and the bottom of your left foot. Bring your attention back to the bottom of both feet. And then focus your attention on the bottom of your left foot. Left big toe. Left second toe. Left third toe. Left fourth toe. Left pinky toe. Left ankle. Left knee. Left hip. Bring your attention to your right hip. Right knee. Right ankle. Right pinky toe. Right fourth toe. Right third toe. Right second toe. Right big toe. Back to the bottom of your right foot. Bring your attention to the bottom of both your feet. Then bring your attention to the rest of your body. Let the awareness move from the bottom of your feet to your ankles, to your knees, to your hips, to your rib cage, your shoulders, both arms, and your head. And then start to deepen your breath. Start to bring small movements back into your body. You can wiggle your fingers and your toes. You can flex and point your feet. Maybe even flex your wrist and move your arms. And then slowly bend one knee at a time so that your feet touch the wall. And then gently roll to whichever side is most comfortable for you. And make your way back to a seated position. And take notice of how your body feels.
Thank you for joining me. You can do this yoga practice up to once a day before your surgery. Best of luck in your upcoming surgery and have a wonderful rest of your day. Namaste.